think that that was recorded. That was my intention. So I'm actually going to go back to the slide and go to the next slide to say who the presenters are. So I am Thalia Kidder. I'm the Senior Advisor on Women's Economic Rights, and I am working as the strategic lead for the Women's Economic Empowerment and Care Program, or the We Care program. And the two presenters are Imogen Davies, who is the Program Development Coordinator for Youth, and Lucia Rost, who I just mentioned, is a PhD candidate at the University of Oxford and has also worked with the We Care program and on youth for a number of years. So we have just done this to introduce yourself in the Google Doc. The broad outline of the agenda for today is to start with this introduction and then to look at some of the top-line findings. Imogen will do this. Lucia and Imogen will then go into more of the details of the research findings, both across the programs in We Care and especially in Uganda. And Imogen will have a final piece of the presentation on what the research is saying about the implications for programs on doing better at addressing young people in unpaid care programs or care in young people's programs, and the role of social norms within the types of programs and interventions, the strategies that we will design. So as I said, this is really exciting for us because we have seen that these three issues about youth and care and social norms are spreading across a range of programs. We'll only be talking specifically about 5 or 6 programs where we've collected evidence. However, the breadth and depth of the work that's represented by all of you as participants in the webinar shows the interest in doing this much more widely. So we're going to then go back to the Google Doc and ask you to write your answers to this question in the Google Doc. What are you interested in finding out about today? Sorry, I'll go back to this. So if you scroll down the Google Doc, we are already getting a number of expectations for today. Thank you to those who have started with your name so we know who you are. Jane is interested in some practical experience about what's been tried and what has worked in terms of social norms. We will have some of that from all of you. I think that the research is more about assessment, and we will have a discussion time at the end of the webinar to think more about issues of awareness raising and risk management. Nikki is saying that young people are often a missing element in unpaid care discussions, and addressing the particular needs of youth in talking about social norms and unpaid care from Anna. Afraid I don't know who ER and ED is, but practical insights for program design, absolutely. Rose in Zimbabwe, how we can be more inclusive of young people, and AF of tackling deep-rooted social norms in the case of youth. So HV, a focus on young people linked with ongoing discussions on women's empowerment. Remy, practical and realistic approaches. So I'll have a couple more minutes to talk about your expectations. I think it is important to have realistic expectations of this webinar, that what we have from the research is more about the insights from research that has been done, both qualitative and quantitative, and looking at what the implications for program design are based on that research. We will have about 20 minutes for discussion at the end, and we would be very glad for your experiences about what you have done already. So I'm hoping that we will meet some of these expectations, but I just wanted to say that we don't have a very wide range of program experience yet. So in order to keep going with our agenda, I think I'm going to just see, Marie, how to effectively engage with youth, maintaining a context-sensitive approach, going beyond numbers and a focus on results. Okay, how can we campaign on this topic? It's a very interesting question. So I'm going to move on to the next slide. There'll be another check-in in a minute. So now we are passing over to Imogen, who will talk about the research overview. So Imogen, please go ahead. Imogen, we can't hear you yet. I think the green button on the microphone needs to be put on. Here we go. I can't hear you yet. Nope.
Hello? Can you hear me now?
Yes, that's great.
Yeah,
wonderful.
Brilliant. Okay, finally. Okay, as Thalia said, my name's Imogen, and I'm going to start by giving an overview of the research findings before we go into them in more detail later on in the presentation. I'm having problems changing the slide.
If you just do a page down on your own computer.
Yeah, that's what I'm doing and it's not working.
Okay. Vincent, I'm wondering whether you could take back the share screen. Okay. Great. So, and the next slide.
Okay, great. So, if we look at a timeline of Oxfam's programme work on youth and unpaid care, we can see that We Care started in 2014, and during its first phase of 2014 to 2015, the focus was mostly on adults. But we did do some activities with children and young people in Colombia, Uganda and Zimbabwe. And also our 2015 quantitative household care survey included some questions specifically for mothers on children's time use. And with We Care, it became clear that care provision is a specific concern for children and young people, and also that we need to do research with children and young people themselves rather than simply asking adults. So that's why we carried out research with children, adolescents and young people in Uganda, in several different regions in Uganda. So first of all, Lucia Rost, who we'll be hearing from later, has carried out a quantitative household care survey with children and adolescents adolescents in 2015 with the same families in northern Uganda and on the same day as the We Care survey with adults, so that we were able to compare adults and children's responses to their activities that day. And then second, Oxfam commissioned some qualitative follow-up research to the effectiveness review in northern Uganda, which researched young people as well as adults. And then finally, we were able to do a really exciting piece of research this year, earlier on in the year in the summer. We commissioned a qualitative rapid care analysis, which many of you will be familiar with children, adolescents and young people in central Uganda. So the findings from this research, which we're going to be discussing today, will support continuing work with We Care from next year, but also activities for the new Empower Youth for Work programme, which has social norms and unpaid care with young people as a key pillar of its theory of change. Can I have the next slide? So on this slide you can see where the research was carried out and how many people were interviewed in each country for the Adult Household Care Survey. And then for the research specifically with children, adolescents and young people in Uganda, you can see the 3 different regions where we did that. Can I have the next slide? So now I'm going to give an overview of the key findings before we go into more detailed presentations. So first of all, looking at time use. This is one trend that we already suspected, but that this research confirmed, and that's that children and young people are involved in a lot of work, and especially in care work. And in northern Uganda, Lucia found 8 to 18-year-olds doing 6 hours of care and 9 hours of total work per day, according to children's own self-reporting. And then across all age groups and in all countries, there was also a gender disparity in children and young people's care work, with girls spending more time on care and less time on sleep and leisure than boys. But what was really noticeable was that while there was a gender difference in care work done by 9 to 12-year-olds, the disparity became much starker once children reached adolescence, and that disparity continued into young adulthood, with adolescent girls and young women doing much more care work than adolescent boys and young men. Have the next slide. So the findings specific to Uganda were also really interesting. So in northeastern Uganda, we looked at which daughters do most care work, and we found that older daughters have heavier care workloads than younger sisters, and that so-called only daughters who only have brothers and who didn't have any sisters have heavier care workloads than girls who do have sisters. And that non-school-going daughters have heavier care workloads than their school-going sisters in families where not all siblings are sent to school. In this region, we also found daughters taking on mothers' care tasks when mothers are doing paid work or they're involved in development initiatives, and that mothers were doing that so shifting their care work to daughters rather than negotiating with male family members, which obviously has implications for the way we do our women's economic empowerment programming. And then in central Uganda, we also looked at the negative consequences of children and young people doing heavy and unequal care, particularly girls. So that included health issues, physical and sexual assault, time poverty and limited mobility. And then we also had some really fascinating findings in northern Uganda, which Lucia is going to talk about later. So as I mentioned earlier, we surveyed mothers and children in the same households in the same day in northern Uganda, and found that mothers reported children doing far fewer hours on care and far more hours on leisure and sleep than what children themselves reported. So we'll be hearing more on that later. Can I have the next slide? So we also wanted to explore how social norms relate to these time use patterns. So in central Uganda, we found that pressure at the household and community levels through ridicule, stigmatization, scolding and gender-based violence from both women and men meant that gender roles are embedded from a young age. We also found, however, that social norms around girls' and boys' different roles become much starker when they become adolescents, which fits in with what we found around time use. And we found that participants said, so among children and young people, men's work was valued much more than care, and children and women were seen as only being capable of doing care work because it was light and simple, unlike men's work, which was seen as difficult. And what was also interesting was that children and women were seen as having similar capacities and status to each other, and that the implied logic was that both boys and girls could therefore be involved in care tasks, but then during adolescence, when boys become more like men, they're seen as having a different capacities and status, so therefore they no longer have to do so much care. Can I have the next slide? So we found in northern Uganda that social norms have a stronger relation to care work for children and young people than decision-making power or personal preference, which we might consider would be very important in determining what care work young people do, but we found that there wasn't that strong relationship which we might have expected. So Lucia found in her research that even children who say they want to spend less time on care work, or who say they're overworked, still choose care as a preferred activity, and that children who are able to decide whether or not to do care work don't necessarily spend less time on it than those who aren't able to decide. We also found gender differences, with girls being happier to do care work and boys being happier to do paid work. And then looking at children's views, we found that children's attitudes are more progressive on care work division than those of their parents or community, which is interesting in terms of our strategies. Can I have the next slide? So finally, when we're looking at how social norms relate to time use across all countries, we found that in those families that value care work over paid work, and in those families that disapprove of criticising women's care work when it's seen to be done inadequately, boys share care work with their sisters more. And then again, looking at central Uganda, youth participants identified that care tasks with a stronger feminine identity, like cooking and cleaning or childcare, may be more difficult to redistribute than those such as collecting firewood, which in this context was a less gendered care task, as an example of that context. And then looking at opportunities for change and breaking social norms, youth participants recognised that in families with parents who are better educated, families who have different views, or with parents who themselves share care work more equally, parents may also ask their children to share care work more equally, and that's therefore perhaps an opportunity for us to be able to break social norms. And then another potential area for breaking social norms around, among children and young people was their recognition that women and men sometimes take on each other's work, so that it was possible to do care work and paid work differently. Okay, the next slide. Okay, so we're going to have another check-in. I'm going back to the Google Doc. So if you look at these findings, we'd just like to hear from you through a quick 1 or 2 minute check-in before we go into the presentations which outline the findings in more detail. What are your first reactions to this research, and what are you interested in finding out more about? What's most interesting to you? So if you go down to check-in 2, questions on findings. So Rose is interested in the issue of more gendered care roles being more difficult to redistribute, and so how do we do this? How do we go about it when it's more difficult? So from Jane, interest in both the kind of social norms we can influence as young people had more progressive views than their parents, and also interested in the transition from those kind of views in childhood to teenagers and to young adults who might have more traditional views or more traditional roles. So from Kate, I'm interested to hear that children and young people reported different amounts of working hours from those their parents were doing. Did you look into the reasons of this? So what are the key findings that give us more information on how to change the norms? From, I'm not sure who's asking that. Just waiting for a couple more responses. Yeah, again, someone interested, Remy, more interested in how the progressive views of youth compared to their parents, how programs can maintain this change, which is definitely something we'll be looking at during the discussion section of the webinar at the end. And then something from Zipporah saying it's interesting to see how socialization has influenced the decisions that boys and girls make on paid and unpaid care work. Okay, I think we should probably head back to the main presentation now, just being aware of time. So I'm now going to pass over to Lucia, who will be presenting her research in more detail before we go back to me, and I'll be presenting some of the final findings and implications for programs.
This is Thalia, and as Lucia gets onto full screen, I'm wanting to say that thank you to Imogen for keeping to time. For both Lucia and Imogen, it's hard to get all of this information to you in a concise amount of time. And I will interrupt if you go too far over time, so I'm being the timekeeper here. And please don't feel insulted if I interrupt, because there's no way to have you see your full screen and also the chat box. Thanks. Lucia, yes, okay, great. We can't hear you, Lucia. There's a microphone button that needs to be green rather than gray. Up at the top. I'm still not hearing you. Vincent, are you able to check in with Lucia about the getting her sound?
Hi, Lucia. Can you hear me? Under help, you can. There's a heart button.
Can you hear me?
Yeah, I can hear you.
Why is it not working? Can everyone hear me now?
Now everyone can hear you.
Yes, we can.
Oh, great. Okay. I don't know what I was. Sorry about that. I'm really sorry. I'm glad it's working now. So I share my screen again. Yeah. Okay.
Can you go back to the full screen?
Yes. Sorry about that. Okay. Now it's all fine. Sorry. Yeah. Hello, everyone. I'm Lucia. I've been working on the We Care program, and I'm doing a PhD in international development at the University of Oxford, which is also related to care and youth. And last year we collected data from women and men in Colombia, Uganda, Ethiopia, the Philippines, and Zimbabwe with the household care survey. And just for Uganda, for my PhD, I also administered a survey that interviewed children 8 to 18 of the same households that were interviewed by the household care survey in Uganda. And today I present on these findings. I'm not going to go into methodology, but if you're interested in that, you can always ask questions at the end. So across the 5 countries, we found that girls do more care work than boys, and that gender differences are stronger among adolescents. Adolescent girls and boys spend more time on care work compared to 9 to 12 years old. And adolescent girls do less care work than mothers, and adolescent boys do less care work than fathers and mothers. While there were no associations for adolescents, we found some associations between parents' views and children's care work, so for those up to the age of 17. We found that boys did more than equal care work compared to girls in households where care work was valued more than paid work, and in households where there was a greater disapproval of criticism for perceived failure to carry out care tasks. So these findings are useful for the work with children and young people, but they are limited because they only rely on adults reporting. So for Uganda, we have data from children themselves. The data analysis on the survey with children is not the final version yet, but I'll present on some initial descriptive statistics. So overall, for the time use, we found that other than sleeping, both girls and boys spend most time on care work. So that's 7 hours a day for girls and 5.5 for boys, so also quite a lot for boys. And both boys and girls spent about 3 hours each on paid work and education and on leisure, and 8 hours on sleep. And overall, girls spend more time on care work and boys spend more time on leisure. But there are no gender differences for education and paid work. Girls also spend more time on supervising children, but in this measurement it's less than an hour a day. And I think there might be a measurement issue because from interviews and observations it seemed like girls were spending much more time supervising younger children, younger siblings. Looking at the different age groups shows that girls of all age groups do more care work than boys of the same age group. But older girls do more paid work, and 18 years old girls also do more care work than younger ones. And younger boys do more care work than older boys, and older boys do more paid work. So this confirms other research that during teenage years gender roles become more pronounced. So here's a table with different hours. We ask mothers to estimate their children's time use, and we ask children themselves to report about their own time use. And there are very striking differences between these estimates, especially for care work. Children's self-reported care work hours are by far higher than the hours their mothers reported. Mothers reported less than an hour of care work, while boys reported 5 hours and girls almost 7 hours. So there's huge differences between these reports estimates. Mothers also reported their children spending less time on paid and productive work, and they thought that their children spent more time on leisure and sleep. there were almost no differences for the time spent on education. These drastic differences show that it's very important to include children in research about them rather than only asking their parents. I think it's also interesting that the differences are most striking for care work, but we don't really know whether children over-report or mothers under-report children's care work hours. Or we don't really know exactly what's going on, so that's something to look into a bit more. And the data shows, this data on activities and social norms shows seemingly contradictory views about care work. So on the one hand, children seem to want to do less total work and also care work. So 60% of children agree or strongly agree that they are overworked. And also about 60% want to spend less time on a care activity. And the activities they want to spend more time on are school, work for the family business, and also leisure. But on the other hand, children do express an interest in the work they are doing. So both boys and girls who decide on their time spent on care or housework do not spend less or more time on it. And the majority of boys and girls are proud of the work they have to do. And also interestingly, boys who are proud of their work spend more time on care work. And half of the children selected housework as part of their ideal combination of activities. And there are also some gender differences. Girls are happier to do care tasks than boys. And they are also more likely than boys to say that they want to spend more time on care work. Whereas boys are happier to do paid work. And boys who do more care work are more likely to say that they would like to do less care work. But this is not the case for girls. So girls who do more care work not necessarily say they want to do less. So there's, children say that they're overworked, but there's still something going on that they seem to want to spend time on it, or maybe they think they're expected to think so, or maybe they get something out of it. So there's a strong indication that this might be an indication of strong social norms. And from other research in this area, it seems like social norms play an essential role in defining who does what. But interestingly, looking at the division of labor, the findings suggest that some children in Uganda question the traditional division of labor, so that these strong social norms are also questioned. Children have very progressive views about sharing tasks. Almost 100% of children agree of a couple that shares care and paid work equally. And only 30% agree of the couples leaving care work to women. But they think much less often that community members would approve of such an equal division of care and paid work. So only 56% think that the community would approve, whereas almost 100% approve themselves. And children also want to divide tasks differently to their parents. About 90% want to share tasks equally in the future, and only 45% say that their parents do so. For everything I've said, there are no gender differences, so both boys and girls seem to have very similar views. And overall, the preliminary analysis of the survey with children in Uganda has shown gender differences in care work and also the importance of understanding social norms in relation to it. And if you're interested in the final analysis, please send me an email and I can send you a report. And ask any questions you might have now already.
Thank you, Lucia. So I think we're now going to have another check-in with our favourite Google Doc. So we're not going to have the Q&A right now. We're going to wait until my final presentation before we have the Q&A. But we are just going to have a quick check-in so you can write down any questions that occur to you while they're fresh in mind while you've just had Lucia's presentation. And then we'll address those in about 10 minutes' time once we've heard from my final findings as well. So if we head back to the Google Doc, so this is check-in 3 Q&A. So just give you 1 or 2 minutes to write down any initial questions specifically from Lucia's presentation before we move on to my final presentation. Yeah, so a question from Kate about who we think is reporting more accurately, children or parents. And then a question from Remy on whether any similar research is intended for the MENA region. From Thalia about we care and youth coordinators wanting to know which programs we're interested in or planning to do research of this sort, either qualitative or surveys in the future. Rose noting that she's surprised that there's no difference between boys and girls' time on education. Yeah, this is an interesting point. From Miriam about how we work with children who have more paid jobs, knowing that we deal with children from 5 to 18, so that it's not just about care work, it's also about paid responsibilities. Again, a question about the reporting and being interesting that mothers would underreport. I'm just going to give a few more seconds for final questions before I move on with my presentation. Evelyn, a plan to translate findings into practical interventions. And then from Haneen, why do you think girls indicated they were happy doing long hours of care work and unpaid care work? Okay, so I'm going to head back to my presentation now, again just being aware of time. Vincent, are you able to show the presentation? Okay, great, thank you. Okay, so I'm going to move on now. But yeah, if you have any more questions that you're still writing out, obviously feel free to carry on with that while I'm talking. So I'm now going to talk about the qualitative research findings, first from the rapid care analysis in central Uganda with children, adolescents and young people, and then second from the follow-up research for the effectiveness review in northeastern Uganda, which was also qualitative. So from this first slide, you can see the outcomes of the time use exercise, which we did as part of the rapid care analysis, which many of you are familiar with, which we did with different age groups and with in-school and out-of-school adolescents, and we had about 20 boys and girls in each of these age groups. So as you can see, the findings show girls and boys estimating similar hours of unpaid care when they're children, and here we can see that younger boys are even estimating doing slightly more hours on care. But then once children hit adolescence, there's a huge gender disparity, and that continues into early adulthood, and that's even more pronounced among out-of-school adolescents. We can also see young men estimating doing more care hours than adolescent boys. So it's important to note here that this isn't a representative sample. As I said, there are only about 20 children or young people in each of these groups. But we have found on our time use exercises during rapid care analysis research with adults to have shown similar time use findings to much wider samples from the household care survey. So while they're not representative, they can still be a good indication. Okay, the next slide. So if we look at social norms, what we observed from RCA participants was that they mentioned social norms relating to perceptions of both gender roles and of care work itself. So first, looking at gender roles, so it was clear from participants that social norms of women as caregivers and of men as providers were embedded from a young age through families and communities, and that these roles were seen as natural and logical and sort of immovable in some ways. And for participants, children were seen as having similar capacities and status to women, which it was implied is why both boys and girls are involved in care tasks at a younger age, but then have more gendered roles, which diversify more and more as they reach adolescence and then go on into young adulthood. So participants also stressed that it was taboo for men to carry out care tasks, especially when they were married, and wives in these cases were seen as either useless or having bewitched their husbands. And then participants, even sort of young participants, reported that men carrying out care tasks would be ridiculed and stigmatized, that they'd lose respect and status from the community and their families, and there wasn't really any sort of contesting of this or sort of view that this might be abnormal in any way. Also that men would fear being taken for granted by families. Participants also said that women might be scolded by other women, experience increased family tension, or experience gender-based violence if they didn't carry out their care tasks in a satisfactory way or the way that they should have been doing. Can I have the next slide? So this is a quote from a young woman participant, but it's also a view that was quite apparent across all the age groups. So she said, in Buganda, it is taboo for a man to cook when I'm home. It's a sign of disrespect to my husband. People will say he was bewitched or that the wife is useless and wonder why he married. He would not have any say in public and might not drink at the village bar. He would be abused by his peers and my fellow women would scold me for disrespecting my husband. I cannot even allow him to come to the kitchen. Can I have the next slide? So second, around social norms, looking at how participants described norms around perceptions of care work itself rather than perceptions of gender roles. So first, care work was seen as work undertaken by the weaker sex because it was light and simple work. And this was in contrast to the problematic or difficult work done by men requiring a lot of energy, such as making bricks or clearing roads and wells. Because men do this difficult work and because of their financial contribution, men are also seen as making the largest contribution to family well-being. And this is also reflected in this quote from a young woman, which again mirrors similar comments made across focus groups of all ages. And she said, girls are looked at as a weaker sex, so they cannot participate in doing problematic work like clearing of the roads, making bricks, clearing the bush, since they require a lot of energy. And the next slide. So looking at how we can break these social norms, which is sort of what a lot of you are asking about on the Google Doc. So in spite of these views where gender roles were seen as very, very normal, natural, immovable, there was some evidence that these norms are not fixed. So participants said that in those families where both parents are educated or where they share care work themselves, their own children may share care work more. And they also recognise that how siblings share care work is a question of upbringing, and so that when parents have a different attitude towards sharing care work, care division between siblings can also be more equal. And then participants also noticed exceptions among adults, where adults did shared tasks differently. So for example, where men and women do each other's work when one of them is ill or away, so showing that it is possible for women and men to do what they call women's and men's work. So these kind of observations can be used in our programming to show that it's possible to do gender differently, and that care role division isn't necessarily natural or logical, which is something I'll go into more when we're looking at the strategies. So looking at the consequences of providing care, which I think one of you said you were interested in finding more about. So we also asked participants what they thought the consequences were of providing this care work. And it was interesting, so the disparity between when you see in the report that they're talking about care work being light and simple and oh so easy, and then when you ask about the consequences, it comes out that there's actually a lot going on. So one of those things was poor health, including back pain and other body pains. Also the risk of sexual and physical assault during water and fuel collection. A risk of being beaten, so children especially given their tasks around getting firewood from private lands risk being beaten by landlords, or at waterhole queues where children are sometimes paid to stand in the queue, so fights can break out. Participants also said that care work led to limited mobility and to time poverty, and I know one of you was asking about so what it meant that children and young people couldn't do. So we asked children and young people what they would do if they had more time, and they said they would spend it on different activities like skills training, income generating activities, studying, more sports, leisure activities and rest. And then some children also talked about how they would spend more time on different types of care work, and that's really interesting because it's something that we've also found from our research with adults, that when women's time on care work is reduced without parallel strategies around awareness raising on social norm change for redistribution, women often do more care work or care work they didn't have time to do before, or different types of care work. So that was quite interesting. That came out for some children as well. So participants also talked about how care work had increased due to deforestation, and that it also increased when sick relatives moved in, or obviously if children lost their parents, and that could exacerbate the negative effects mentioned above. Can I have the next slide? So as you know, in the rapid care analysis, one part is about sort of how do we address problematic care work, and I won't go into a lot of detail on that now because it's something we can discuss in the discussion session later, but the groups focused on addressing their top 2 problematic care tasks, and this was the same across all of the groups, and they chose water and fuel collection. And it's quite interesting to note that the care tasks which are more done by boys were chosen as the most difficult, and the care tasks which were less gendered were those that were more difficult. And participants also noted that they thought that redistributing care tasks with a stronger feminine identity, like cooking or washing or caring for children, would be more difficult. So they came up with practical solutions, awareness raising on gender roles and advocacy initiatives, and again that's something I'll go into more later. I can have the next slide. So as the final part of the research findings, I'm going to talk about the findings from the effectiveness review follow-up, which was qualitative research done in northeastern Uganda. So we mostly looked at findings on daughters' care workloads. So we found that older daughters carry out most care work compared to younger sisters due to childcare responsibilities that they have for their younger siblings, which obviously the younger siblings don't have. We also found that only daughters without sisters to help them have heavier care workloads than those who do have sisters who might be able to share that care workload. And that girls whose siblings attend school have to provide more care for the same reason, that they don't have their help with their sisters because their sisters are in school. And then we also found that mothers being involved in paid work or development initiatives can greatly increase girls' care workloads. So we found that mothers will often shift care tasks to daughters instead of negotiating with male partners, and that women studied in this district tended not to view new employment opportunities as problematic because they knew they could just give the work to their daughters. So finally, some slides on implications for programs. So when we're thinking about this, we're often asked about how we can integrate youth analysis into care programs or how we can integrate care analysis into youth programs. So I've pulled out some recommendations based on the findings, but this is very much a discussion, so I will pull out what I think could be some interesting recommendations, and then during the discussion session it would be interested to hear your thoughts. So can I have the next slide? Vincent, are you able to change the slide?
Yeah, I did. There is currently the slide on social norms on screen. Or do you want the previous one?
It wasn't showing on mine. Okay, that's fine. No, can I have the age-specific interventions, please?
Sure.
Sorry, I don't know why my computer's being slow. Okay, great. So how can we make our interventions specific to different age groups? So one recommendation might be that given the extent of existing care and also productive responsibilities, as someone said in the Google Doc, for adolescents and young people, and the negative consequences of these that we've just seen, youth programs have to take these roles into account before we start doing our own work with them. Otherwise, we risk overloading them. And likewise for women's economic empowerment programs, it's important to take account of how daughters pick up care responsibilities from mothers as a matter of course, and how program interventions may therefore negatively impact on girls' empowerment, even if at the same time they're increasing mothers' economic empowerment. And given that care roles become significantly more gendered with adolescence, although that might change sort of depending on the context, there's an argument for interventions starting before adolescence, especially interventions on redistribution, before girls begin to take on significantly more care, before gender roles, gender norms, around roles and care roles set in. And then as older only and non-school going daughters are likely to have heavier care workloads, we need to take their specific needs into account in our programme interventions. So looking at how interventions on social norms can be built into our programs, several of you are asking sort of what does this mean about how we do our interventions, how can we change social norms. So we need to go beyond looking at decision-making power to explore how care work relates to social norms, but also to identity and pride, which from Lucia's research came out as really important factors in determining care work, and integrate this awareness into our interventions. And we should also note that awareness-raising initiatives which promote care work as skilled and difficult, rather than light and simple, may support care work redistribution, given that the fact that it was seen as light and simple meant that it couldn't be done by men. And that might mean it can be redistributed more effectively to men and boys, but again that would be something I'd be interested in hearing about, especially in relation to the research that's been done with adults. So it's important to promote progressive attitudes in families on valuing paid care and on the acceptability of criticism, because we've seen that they can affect how care work is distributed between brothers and sisters. And then related to this, we should look at social behaviour and how things like ridicule, stigmatisation, gender-based violence embed care roles so that can support our redistribution efforts. And then it's also useful to recognise that certain types of care work with a stronger feminine identity might be more difficult to redistribute. Have the next slide. Okay, so finally, what do these findings mean for our strategies? So the good news is that progressive views may be more common among young people, giving an opportunity to change norms at that age while young people are still young. And there may also be opportunities to break social norms where an alternative is being showcased. So for example, in more progressive families and where women and men do each other's tasks in some circumstances. And then I think if we just take away one thing from today's webinar, we need to remember that we have to involve children and young people in research, and let's not just ask adults or parents, because as we've seen, that can give vastly different results. So far with We Care, we've worked with children and young people through public communications. So for example, there was a TV advert in Honduras with young people discussing care, and a TV show in Colombia with a celebrity chef doing cooking classes with young men. In Uganda, we've worked in We Care with schools to promote boys into taking care work and doing shows and theatre and discussions with pupils and parents. And then we've also worked with young change makers in Zimbabwe, so young people talking to community members about doing gender roles differently. But there also seems to be a gap in advocacy and policy work, looking at what's been done so far. So I'd also be interested to hear your thoughts on this during the discussion. Can I have the next slide?
The next slide is on screen, yeah?
Yeah, okay, yeah, so it's just taking a bit of time to come through on mine. Yeah, so this is just a screen grab from the cooking classes that were done with a celebrity chef in Colombia with young boys in rural areas. Okay, so I am going to pass back to Thalia now, who's going to facilitate the Q&A. Hopefully I'll do it in time.
Yes, you did very well with the time. So we're back with the Google Doc. I'm wondering, actually, Vincent, if you could show that wonderful photo of the celebrity chef. So we'll have that on the screen, but we'll work in the Google Doc right at the moment. I'm going to start with the questions that came up while we had the Google Doc up last. and talk about a few answers, and then we'll see what answers Lucia and Imogen can pick up as well. One of the things that I think is really important to understand about how we are talking about social norms within both this youth-focused area of care work and with adults is that we are recognizing that we need to change perceptions about care tasks and care activities themselves, that they are significant, that they are difficult, they are not just entertainment like leisure, you do cooking for leisure or you have fun with your kids, that they're skilled, they're not petty work, they're not unskilled work, they're not naturally what women do. You actually have to learn the skills, and also that they are they can be areas of life that are really satisfying. So we're trying to get away from the idea that all of the work that one does in the house is just drudgery, and what you do outside of the house in productive and paid work is what's really satisfying and rewarding and challenging. So I think that those things are areas that we could look at both with youth and with adults, as well as thinking about the gender roles. So there are gender roles in care work. There are gender roles obviously between care work and paid work or productive work. There are gender attributes about what women and men perceive themselves to be good at. So things like young men can't learn to take care of a baby. The research that's not reflected here but is relevant is some recent research on gender and social norms in care, and also gender-based violence that was done in Zimbabwe. And one of the things that I thought was specifically relevant was that girls were given care work and taught to do care work because then they would be good wives. But boys didn't need to learn care work to be good husbands. So it seems to me that the whole question of why care is passed to daughters rather than sons has to do with gender roles about boys and girls, daughters and sons, but also this perception that to be a good wife, you need to have those skills and know how to do things well. Who is reporting more accurately? What the discussions so far have come up with is that it was seen as not socially desirable for a mother to report, because we were asking mothers about the time use of their sons and daughters, that they were working so much. So both housework, care work, and paid work was underreported, whereas sleep was fairly accurate, well, fairly similar to what children reported, and also education. We were also hearing that perhaps children were over-reporting the hours, saying, oh, it must take, you know, an hour to go collect water when it actually takes 35 minutes or something. So I don't know that there's a single answer about the discrepancy between mothers' reports of children's time use and children's reports of their own time use. So Rose, you had a question about could one of the interventions be about skills for young people to provide quality care, and I think this is a very interesting avenue to explore, because the perception is that it is, with adults, that it is more skilled to know how to care for farm animals than it is to know how to care for children or care for elderly or disabled people. This came from a ranking exercise done with adult men and women. But to increase the perception of it being skilled to learn to care for children and dependent adults would also mean that people were learning those skills and providing more quality care, either as unpaid or paid work. I think that Promundo and other organizations, as Nikki mentioned in the chat box, have done quite a bit to really promote the idea that it is satisfying and increases the quality of life for young men and men to be involved more in housework and care and share, and the anecdotes also about having healthy families and happier families when care work is shared. So I've tried to do some of the answers, and I'm going to ask you to go to the Q&A and see if there's any more questions that you want to put into the chat box. And also I'll give a moment to both Lucia and Imogen to be able to answer questions that I haven't answered or add to my answers. So over to you, Imogen.
Sure, thanks, Thalia. Yeah, I think especially just on your last point, I was quite interested in whether increasing perceptions of care workers skilled would actually lead to more equal sharing, because sort of, as I said, from the RCA it seems like that is the case, because a big part of care work not being given to men is because it's seen as light and easy. But then I also remember you saying from the household care survey that valuing care did lead to more equal sharing, but that it being seen as skilled didn't necessarily, because then it was seen as too difficult for men to be involved with. So it would be interesting to hear more from you on that, and whether there have been any resolutions in the household care survey. But I'll pass back to you after we've heard from Lucia. But in terms of the questions, adding to your answers and getting to the questions that weren't answered, yeah, I think on the girls reporting, girls and boys reporting many more hours than parents reported. I'm sure Lucia will have more to say on this, but I did interviews with all of the We Care program leads around this, and I think the general feeling was that while children might have exaggerated a bit, those hours were more accurate than parents. Like I remember the program lead for Columbia saying there's just no way that girls in rural areas do less than an hour a day on care work. And across all of the countries, it's really interesting to see that all of those 5 countries, mothers report girls doing less than an hour a day on paid care, on unpaid care work. So I think that was just seen as really not realistic, so that children's care hours, while they might have been a bit exaggerated, were still more accurate than those which mothers reported, and that was due to mothers feeling like they shouldn't be exploiting their children, and that sort of making their children work would be seen as exploitation, which is also interesting in terms of the kind of messages we give across about what exploitation is. So Rose talks about being surprised that there's no difference time between boys and girls in education. I was also really interested by that, and it's obviously not what we'd expect, so it'd be good to hear more from Lucia on that. So how do we deal with children who have paid jobs, working with children who are 5 to 18? Yeah, I think that while we're talking about unpaid care, it's also really important to note that especially in the RCA, it came out that boys were also doing huge amounts of paid work. And so that's something that we also really need to take into account when we're looking at doing our youth programming. And not overloading girls and boys in either way, whether the work that they're doing is care work or paid work. So I think responding to Rose's question about disability, we didn't specifically look at households with a disability. I think we focused on out-of-school children, but as far as I'm aware, we didn't specifically look at disability. But I know that there's some really interesting findings in Zimbabwe about the restrictions which having a disabled family member, for example, in the household, what kind of consequences that brings. And that was something that came up when children were talking about negative consequences, that when there was an ill family member who might move in, that greatly increased their care work, and meant that those negative consequences which they talked about were greatly increased. So Kate's question about whether we looked at the reasons for passing care work to daughters rather than negotiating with male partners. What was interesting about that was that while if there was sort of productive work to be done in the fields, families would often consider getting paid work in. But when it was a question of care work being done, it was out of the question. It just wouldn't be considered, and it was automatically passed to daughters. And I think, just given that that it's not socially acceptable for men to be doing those kind of tasks, it wouldn't necessarily occur to women to ask, or it might not be acceptable for them to do so. But then that's also a consideration of what families consider acceptable to say to outside people, so that's also the limitations of research. I'm going to pass over to Lucia now, and while she's talking I'll have a look and see if there's any more questions. And then I'd also be interested in hearing from Thalia about what I mentioned right at the beginning about sort of skilled work and valuing paid care work, and which of those is more likely to lead to successful redistribution among adults.
Yeah, thank you, Thalia and Imogen. You've already answered most of the questions. I don't know what I can really add, but maybe about the methodology. There was a question about methodology. Thalia has already typed in the details for the household care survey in the 5 countries. And just for the children's survey, there were about 560 children interviewed. They were always from the same households as the household care survey. Usually about 2 children per household, a boy and a girl. And the questionnaire was inspired by Young Lives project, and it was really kind of supposed to be more child-friendly and with lots of games and activities. And we used a lot of images and beans. Also for the time use, we used beans for each hour of the day that the children would assign to different categories, different images that were also designed in the field that represented different activities. Yeah, so that's about the methodology. Then Imogen said the question about why there's no difference in education. I don't really know. When I was in Uganda myself doing some participant observation, I actually saw a few girls being taken out of school to do tasks at home while I was doing participant observation, and I didn't see any boys. I actually saw some girls being taken out to look after their younger siblings while their mothers attended an RCA in rapid care analysis. So yeah, I saw that, but I don't really know. I mean, there's more to look into. And yeah, I think about the different hours, it's a really interesting question, and as Thalia and Imogen said, I think it's probably something in between, that maybe children over-reported a bit and mothers under-reported a bit. And also about the question about paid work and what to do with children who want to do paid work. One thing I thought was interesting, that enumerators actually said that children seem to under-report their paid work because they thought that they might get the opportunity to do more paid work because they were being interviewed and maybe we would offer them some paid work, and they wanted to do paid work. So I thought that was interesting, that yeah, they were actually hoping to be able to do more paid work. So that's definitely something to consider. Yeah, I think most of the other points have already been answered, but please ask anything else if I can be of help.
Thank you. It's a very helpful discussion, and there are more answers about the skills that are in the Q&A, about 3/4 of the way down. We have already gone on, many people have already gone on to the discussion questions, so I'm going to encourage everybody else to start with the first discussion question or go on to the second if you've done the first. First about our ambition. What change do we want to realize on unpaid care among young people? And Jane is starting with increasing the options, changing the transition from children to teenagers where care work becomes very gendered. Then another way of coming at the issue about children and young people, Sephora, empowering and supporting men and women who choose to be positively deviant, and perhaps looking at the elderly people as a way of supporting boys and girls as well to do something different. So Namta from Zimbabwe, how do we break the taboos? We're trying to figure out who the key groups are to work with so that care work can be done with pride, especially over boys, with older boys, the issue of not lessening manhood, pride, and masculinity. Kate is asking more questions about the types of care work, care tasks that boys and girls are doing when they're young enough to have roughly equivalent hours. I think we haven't looked into this very clearly, but my guess is, as you have said, that boys may be doing some more of the masculine, quote-unquote masculine tasks like carrying fuel and water, and perhaps girls are doing more of the people care earlier on. Rose liked the idea of catching them young. Kate, yes, indeed. We have to figure out both about how the family and the men will be perceived and the women and girls' ability to ask for help and negotiate for help. Help in quotation marks. I know that we don't have a whole lot of time. I am going to encourage us. So the second question is, what are the issues to overcome in achieving this? Could I suggest, with the time that we have remaining, that we actually focus your attention on question 3 about successful experiences that you've had on changing norms and behaviors related to unpaid care among young people. Now, this may not be the whole package of young people and care tasks and social norms, but it would be very helpful for all of the people involved if you know anything about this area, either inside or outside of Oxfam supported programs. So we're seeing people typing under question 3, what successful experiences have you had on changing norms and behaviors related to unpaid care among young people? And I'll wait for a minute and let you put in your thoughts. It's really wonderful to see that we have so many different experiences to draw from that we should bring together. Yes, Promundo's excellent work with children and their parents. A strategy in the My Rights, My Voice program in Pakistan, a soap opera addressing social norms on parents supporting their children to know more about sexuality and reproductive health. I'm going to then say, since I've got the microphone, that the Sexto Sentido soap opera, which is focused on young people, was filmed in Nicaragua, has some episodes about young men learning to cook and wash clothes. And that's available online, and there are some that are translated into English as well. The sister-to-sister mentorship, yeah. Jackie, experiences about stepping into other shoes, swapping tasks for a week and see how it feels. I wonder if there are any examples of that that you know of that we could highlight. Claudia, teaching young boys that they can care for others, even from a toddler age. Boys doing cleaning tasks at school were more likely to do them at home. Social behavior change communications, people at Johns Hopkins, we should look into that more. Okay, and with a very few minutes left, if you're done with question 3, could you think a minute, all of us together, about targets and allies for influencing and spreading the messaging? And what evidence do we need in order to influence targets and allies at whatever level to take this issue more seriously? How would you do it in your context? What do you need to know to be able to go meet with either allies to have them take on the issue of youth social norms and unpaid care, or who are the targets who we would want to change their policies and practices? Rose, the Ministry of Education. Jackie has a long list. Teachers, celebrities, faith leaders, the creatives in our community who write and tell the stories. Kate, YAC, I think, is Youth, Adolescents, and Children. There's a cross-affiliate group on domestic education, yeah. Project with young people to address gender inequality. So it's, I would guess that it's a matter of having people who work on young people and development to also think about unpaid care and gender roles and social norms as part of development, which is an issue that we have seen across our organizations, that unpaid care and gender roles are beginning to be very much understood, recognized as not a personal, family, cultural, religious issue, but actually a development issue and a poverty issue and a gender equality issue. Okay. We have a couple more ideas here, a couple more minutes to go. Imogen getting young people, involving them in decision making, and to meet with duty bearers to tell their own stories and lobby. This is very much about the My Rights, My Voice legacy. Remy working on all levels, bottom up and top down, practical real evidence to influence others, and having young people to be the leaders as well. NAMTA, key allies, men's groupings, organizations, understanding whether we share the same understanding on the issue. How do we influence youth organizations to take this on? Disaggregated data for young people, absolutely. Yeah. Okay. Imogen, I'm going to pass the microphone back over to you to see whether there are any last words that you have. Be helpful to know where this is going in terms of, say, from the We Care point of view, that we have significant funding for programming in Zimbabwe and Philippines, and ongoing projects, especially about research and influencing and policy advocacy, also in Zimbabwe with another team with Oxfam Canada, and in Uganda and in Ethiopia. There are many more of you that are working on these issues with the IKEA-funded Empower Work for Youth program and other youth programs that I probably don't know all of you that are on this call. So I would hope that we can figure out a way, perhaps with the Knowledge Hub, to keep bringing these updates in and have a corner of the platform that will be bringing together the documents and the experiences that we're talking about here and following up with it. But over to you, Imogen, to say the final words, and thank you.
Thanks, Thalia. Yeah, so I noticed in the original Q&A actually something that we didn't get around to talking about was where do we go from here, and how can we ensure that a focus on youth is integrated into our care programs and vice versa. And I think that especially on our programs on youth and employment, we're already seeing with Empower Youth for Work, which is going to be going on for 5 years in 4 countries led by NOVIB, that social norms around care is already a key pillar. So that's a huge step for Oxfam. That's a massive leap forward, that it's something that we're considering. And there is going to be some specific research as part of the Empower Youth for Work programme, which is going to be led by the Women's Economic Empowerment in Agriculture Knowledge Hub. So Claudia Canepa is leading on a piece of research specifically looking at social norms around work and unpaid care. And I think that's something that, building on this research, we're going to be integrating as hopefully we're able to increase our youth programmes around youth and employment. But I think beyond looking at economic empowerment, it's also really important to look at integrating evidence on social norms on care into our other programs, for example on political participation, on child marriage, and existing child marriage programs. So take an approach of looking at the limitation of education and employment opportunities, and also social norms on gender-based violence and sexual and reproductive health, but we haven't yet looked at social norms on care. So I think there's more work to be done to go beyond looking at how social norms affect economic empowerment to looking at how they affect political participation in other areas of our work. So going beyond the kind of home of We Care in economic justice to other areas like gender justice and governance. But it's really exciting that we're having these conversations, as I said, and as Oxfam we're making leaps and bounds, both in our work on care and in our work on looking at young people, and it's great that we're now able to look at the intersectionality of how those two areas cross over. So I will leave it there because we are now about 4 minutes over. So just to say thank you very much to everyone for joining. Thanks very much to Thalia for facilitating and to Lucia for presenting as well, and for all the wonderful research she's done alongside Oxfam's research, which has really enriched our understanding of care work among young people and children. So on the final screen there you can see all of our email addresses. So if you have any questions, especially note Lucia's email address because it's not an Oxfam email address. We're able to send you more reports, more findings, or you can also send us an email if you want to find out more. So I'll leave it there, but thank you very much and let us know if you have any more questions.